Asking a counsellor to see Jack enables us to have insight into how Jack is feeling indirectly, as he may not feel comfortable speaking with us yet. This could be for cultural reasons or personal reasons. So, when enabling Jack to see a counsellor, it allows us to determine how he is feeling on a more direct scale. By speaking with a counsellor after his consult with Jack, it allows us to debrief. As allied health professionals, communication is important to ensure best patient care. It allows us also to decide what is the next plan of care and how we will be actioning this.
Jack feels very happy to hear the news of his discharge planning. The nurse in this phase makes sure that Jack, the patient, gets appropriate care even out of the hospital for his well-being. The nurse educates him about the precautions he needs to take and also acts as a mediator between the patient and the other healthcare services that might be needed along the path of recovery.
Jack is overloaded with information upon discharge and is nervous that he will not be able to appropriately fulfill his healthcare needs once he arrives home. He is unsure how to access the appropriate care and is worried about trusting outsiders with his care all over again. Molly and the Aboriginal healthcare worker must ensure that Jack is appropriately educated on such matters before he is discharged. By educating Jack on how to care for his detached retina before leaving the hospital for home, and giving him an information packet, he will know how to ensure his eye is healing correctly and who to call if he needs help.
Molly the RN has brought in Mrs. Burton to explain the ramifications and further complications that Jack will be undergoing post his stay in hospital. Although Jack is considered an adult and able to make decisions, it is good to communicate with his community about how they can assist in his care.
After Molly has sufficiently educated Jack about the requirements regarding his discharge, he can begin the journey home. The hospital has arranged transport for Jack's journey home, and provisions for Jack's care upon his arrival have been made.
When arriving home, Jack is welcomed by the community, who are made up of his family and friends through a strong sense of kinship and land. These extended family relationships form the core of Aboriginal community and are central to the way culture is passed on and the society is organised.
In Australia, the gap between Indigenous and non-Indigenous within the healthcare setting is substantial, with a 17-year difference in mortality rates, less equal opportunities for healthcare, increased rate of diabetes, alcoholism, drug abuse, renal failure and cardiac disease. The Indigenous population are disadvantaged. The social determinants which underpin these factors can be due to lack of education, inability to access healthcare, and physical location of the population in regards to the healthcare setting. While there's been a push to close the gap, it is still prevalent with no long-term goals in sight for things such as life expectancy. Up-and-coming generation are expected to face the same issues.
As Jack is an Aboriginal male living rurally, this is extremely relevant in his transition home and future well-being. He needs to ensure that his health remains a priority and that he takes advantage of the healthcare services available in the local area. Jack needs to work together with his community to help his health progression and that of others.
Jack would have experienced severe culture shock during his transition from home into the hospital setting due to loneliness and loss of identity suffered in the city environment. Returning home would be extremely beneficial to Jack's sense of self and also play a large part in increasing his mental health and well-being.
By communicating both with the healthcare team and Jack, seeing to Jack's needs and ensuring that he feels safe, is understood and understands what's going on, we create a patient care that is culturally safe and welcoming for patients coming from the rural and remote areas of Australia.
Thanks for watching.
Created using Powtoon.